Medical imaging workflows often require clinicians to click through image slices, switch between disconnected tools, and generate reports that involve manual contouring, biomarker interpretation, and validation steps. HEA³ by RastrAI brings these steps into a unified clinical imaging workspace. After secure sign-in, the user can load an incoming DICOM case and review the complete cardiac MRI study. The workspace supports AI-generated contours, guided myocardial analysis, manual correction, zoom, and slice-by-slice review, while preserving clinician oversight and final sign-off. Current and prior studies can be compared in one view. The platform processes the image stack and presents an AI-assisted comparison with structured findings, helping the reviewer understand relevant changes without leaving the workflow. Following the comparison, the platform generates a structured summary supported by relevant imaging evidence, highlighting important changes and findings. From the same study, selected contours can be combined into a three-dimensional stack. A reconstructed mesh creates a digital representation that can be rotated and inspected from multiple directions, supporting clearer visual assessment. The workflow also extends to coronary angiography. Incoming images are analyzed for vessel anatomy and possible areas of narrowing. Detected regions and segmentations are overlaid on the source image, with measurements and structured findings presented for review. Clinicians can review and validate this evidence and, when required, use it to prepare a draft report while retaining full control over the final interpretation. Following the analysis, HEA³ brings together the imaging findings, measurements, and supporting visual evidence into a structured comparison result. This is supported by HEA³'s priority journey and risk analysis layers. The clinician can review the evidence, make any required changes, and prepare a draft report while retaining full control over the final interpretation and sign-off. Based on the findings, procedure, and overall risk profile, the member can be enrolled in a personalized cardiac recovery and risk management program. The program monitors medication adherence, medication tolerance, cardiac rehabilitation, and recovery after the procedure. Using HEA³L, care teams can monitor each member alongside the wider cardiac population. They can identify missed medications or appointments, detect abnormal measurements and care gaps, prioritize high-risk cases, and intervene when clinical support is required. HEA³ connects cardiac imaging, clinical validation, reporting, and continuous care management in one coordinated journey while keeping clinicians and care teams in control.